cornbread and make sure that you actually know what's going on. Okay, so the thing just came on and said I just went live, so I do need to say all that again. It's so hard when we're streaming as well as we're on the radio. So, for those who are just tuning in to us on the stream, welcome to Alicia Reece Soul Food, another episode, Food for the Soul. We've got a very hot show today. And so I want everyone to share to our page. And we've got a special guest talking about health. And each month we always have a special segment powered by Interact for Health because your health is your wealth. And boy, do I know that. I have been really suffering lately and trying to do better at taking care of my health. But without your health, you have nothing. So we like to get into things that can help you improve your health. Also, the health industry as a whole. We need workers. We need a workforce. We're going to be talking about there was a study and survey that was out, and we're so excited to have the health collaborative that we have in our community that's able to kind of help us understand where we're going, what we need to improve on, how do we improve on it, and keep the data so that we can see if we're making an impact and then looking at areas that we need to make a better impact. So we're going to get ready to jump right into it. And later in the show, we're going to give you everything you need to know about the Cincinnati Black Music Walk of Fame. Put it on your calendar. Everybody's been asking me about it. It is Saturday, July 26th. Saturday, July 26th. We're taking in the late, great jazz giant, Nancy Wilson. The Ohio Players, all the funk sound that they created. The mighty OJs, everybody. Man, we're talking Rock and Roll Hall of Famers and soon to be Cincinnati Black Music Walk of Famers. And the gospel icon, Dottie Peoples. One major thing I wanted to let y'all know that Dottie Peoples, I talked to her last night. She wanted everyone to know that she will be performing. Okay. She will be performing one of her songs. So, we're wearing all white. It's a free event, and we'll have more information for you later in the show. But right now, I'm super excited to have in our virtual studio the CEO and president of our health collaborative. And I want to make sure I say your first name right, Deidre.
It's Deirdre Balloon. But
Deirdre.
Commissioner Reece, if I was worried about how people said my first and last name, I'd be kind of irritated all the time. So don't worry about it. I'm completely fine. It's Deirdre Balloon, but if it's some variation, let's just roll with it. We got lots to talk about. I'm so honored to be here. And I just want to say thank you for sharing your comments about your own health and your own health journey and self-care and how important it is, and your health is your wealth, because that's one of the most important things. We're going to talk a lot about community health, but it starts with the individual and empowering yourself to take care of yourself. So I really appreciate you beginning this conversation with inspiring people to do that, because that's critical.
Well, I appreciate it. I appreciate you being on the show.
Yeah.
We're going to go through some of my health journey, and I want people to come with me because it's a lot of changes, and it's difficult when you're on the run. And as a woman, we take on so many things. I mean, we've got so many things that we take on. And a lot of us as women, we always, we're overachieving. We want to do everything right. We want to help everybody. We can't say no a lot of times. And we always seem to put ourselves last. And we're paying for it because if some of us are not around, the glue it unravels. So I'm so happy to have you on the show to tell us a little bit about what's going on. What do we look like as a region as it relates to our health? Because there's so much, whether it's the air quality, whether it's what we're eating, whether it's, are we taking care of ourselves? Are we getting rest, the stress? It's just a lot to deal with, and it affects our health.
It is a lot, and I really appreciate this opportunity. I spoke with your team and shared with them a little bit about the work of the Health Collaborative. So let me just introduce the Health Collaborative. The Health Collaborative really is a community-based organization. It is a collective investment by all the hospitals. This is really rare, and I want people to understand how important it is. All the hospitals, and we're a very highly competitive environment with 5 major health systems and a fantastic children's hospital. They've decided to come together for years to work collaboratively on things that really address community health, and that is community health. So we lead the community health needs assessment, which is what I'll be talking about. Tons of data that really describes Hamilton County as well as 18 other counties across the region. They also want us to work on workforce, which we're going to talk about that in a little bit. You mentioned that in the intro, how important it is for us to have team members in our community who are there to take care of us when we need it for our health. And there's a ton of opportunities. I'll say this over and over again, 11,000 jobs are open right now in this region. Of the top 10 jobs, 7 of them are over $60,000 jobs.
Wow.
There is a huge economic mobility opportunity and a huge ability to help increase our community health because we'll have the appropriate number of staffing to support us in our time of need. The third thing they really want us to focus on, again, this collective investment by all the hospitals, is emergency preparedness. And so we've led large-scale emergency response as well as preparedness for over 2 decades. That's really the framework for the Health Collaborative. We bring the hospital goals together with community to address large-scale change. We partner with tons of different community-based organizations to help facilitate that. I'll give a shout out to Closing the Health Gap. We partner with them. They have a very clear objective of really empowering the individual, as you described, taking your own health and making sure they feel empowered and encouraged and have the resources to do that. So they're very focused at disparities and empowering the individual level. We're working at the systems level, the hospital level, to address those 3 key areas. And so we do this all in partnership with the hospitals, but also the community partners. Interact is a great funder of ours. I know they're sponsoring this. We couldn't do this work without the hospitals and community-based funding from folks like BI3 and Interact for Health. So that's a little snapshot or introduction to the Health Collaborative.
Yeah. And I'll give you a fun fact.
Yeah.
So when the Health Collaborative first was put together, and it's a lot more sophisticated now. It was basically a concept, like you said, the hospitals, etc.
Mhm.
And there's very few boards that I agree to sit on because I want to be able to put time in. And this,
Yeah.
when I was on city council, and I just got elected, and this was one of the boards that I was on, and just getting it
That's
started.
awesome.
And I'm just so proud of how it has really grown. But I would say the Health Collaborative, and it was tough because back then, this was before, Affordable Care Act, and this was before there was a lot of focus on health. It
Mhm.
was kind of like health is over here. And I chaired the health committee for the
Mm.
city. I don't even think they have a health committee anymore. That's how, I was kind of like, well, you're not on the powerful committee. I thought that was like the most powerful because I was like, if your health shuts down, it shuts down economic development. It shuts down jobs. It shuts down everything. And we did a lot of work with it. So that's how I ended up on what was then a new concept.
Yeah.
But I would say during COVID,
Mm-hmm.
because of the Health Collaborative was established there, at least we had a conduit, if you will, because that's when it got everybody's attention.
Yeah.
Where do we go? How do we work together? How do we go across hospital systems where it's not like, oh, well, you're in this system, but you can't go to this hospital for that system? It broke down all the walls, and it could not have been done if we didn't have the Health Collaborative there as kind of the convener and the place. And it's very important because you can't wait until you have an emergency. And I know we all say, let's stay ready so that we don't have to get ready. But the reality is, a lot of times we don't think about things like, what happened with COVID or what we're seeing with these. But now people are, paying attention with the flood just coming out of nowhere. What happened in Texas, or we had a flood here, and we don't think about these things until it happens, and then we're like,
Mm-hmm.
where do we turn? And
Mm-hmm.
the Health Collaborative is saying, hold on, let's keep preparing. Let's keep getting data. Let's convene. Let's be so we're ready and we don't have to start to get ready if something does hit us.
Commissioner Reece, I'm so glad that you brought that up. I think the Health Collaborative's role during COVID was a perfect example of us living our mission, which is to bring healthcare leaders and community leaders together to address really critical problems that are best solved together, often can't even be solved alone. They have to be solved together. And COVID was a perfect example. And I want to give some shout outs and some explanation to how we really did that. I was not at the Health Collaborative at that point. I was actually working with United Way. And so one of the things that the Health Collaborative did was work with all the health systems, set up the testing sites, but they did it through a lens of equity. And that was the direction of Hamilton County. And so our response for testing was very different than any place across the state. When people were going through testing, they shared, I don't have a thermometer. I can't quarantine. I don't know where to go. And so the Health Collaborative worked with United Way to get a data feed daily to United Way that allowed them to understand who would needed extra services. United Way then, this is when I was working at United Way, reached out to those community members and were able to provide food kits and health kits. And that was based on Hamilton County funding to United Way to do this care coordination program. They then did a screening of social determinants of health and found out they had housing issues and rent issues and mental health issues. So we were able to do a wraparound services for those folks. But none of that would have been possible had not Hamilton County given the funds and directed it to do a lens through health equity. And the Health Collaborative had all of those partnerships and the convening and the data capabilities for us to be able to get this data in the real time. That neutral convening to be able to respond collaboratively. Everyone put their guards down. Government leaders came together with healthcare industry folks to really solve it for the community. And it was a shining example of, I think, of what we can do in times of crisis. I will point out, though, one of the reasons why we had that role was because we lead the Tri-State Disaster Coalition. This is something we've done for 20 years. It's federal funding that goes to the Ohio Department of Health and then goes to regions. There's these type of regional coordinations across the country. They came out of Katrina and 9/11 when the federal government recognized there was no coordinated neutral body to bring together the hospitals, public health, the emergency management system, and the public. So let's think about who that body could be. We've held that contract for over 20 years. Unfortunately, President Trump has stripped it nationally. So $280 million that goes across the nation to support little coalitions like ours is really threatened to be gone next year. We're working on sustainability, what that could look like. We're working on advocacy, but it is a big challenge because it's really what we have been known for significantly, which is bringing over 100 different organizations together to prepare, to practice for crazy floods and cybersecurity issues, but then also to respond. And so we're working hard to get the word out about that challenge for our future, for our community. And I appreciate you giving a recognition to the Health Collaborative's role in neutral convening and response through the pandemic. It really was where our mission was most illustrated.
Absolutely. We're talking about the Health Collaborative. Let's dive into some of the data, what's going on now. I know we talked about what, in terms of COVID and those kind of things, but there is some, you did a study in terms of what's really, what are the number one killers right now in Hamilton County. And one of the things I have been working on is this cancer caucus, but cancer being one of the big ones. Talk a little bit about what are people, what's hitting people hardest and what your data shows.
Sure. I appreciate that opportunity. And I want to do a few things. I want to really make sure, and I know Commissioner Reece, that you're really committed to empowering people with action. So as I said, we're really at the systems level, but we do have partnerships and connections. And so I want to make sure there's time to give some clarity about what people can do. I have 3 objectives today. I want people to be excited about the possibility of working in healthcare. I want them to understand that they can take some actions themselves to understand their own health. And finally, I want them to check out the Health Collaborative and see all of this rich data. I'm just going to mention a few things today, but there's a ton more. So think about a job, think about taking care of yourself, and then think about checking out our website with tons of data. But we lead the community health needs assessment, which again is an investment by all the hospitals. The hospitals, nonprofit hospitals, have to do this. It's part of their IRS requirements. And so, again, the hospitals could do it individually, but they've asked the Health Collaborative for over 10 years to lead this effort, which is every 3 years, to do a community health needs assessment. Now, this isn't a hospital assessment. It's a community assessment. So we bring together over 50 organizations. This is led by Lauren Bartosik, Dr. Lauren Bartosik from our team. She brings together all the hospitals, public health institutions, all the community-based organizations to really think about what data do we have, which I'll highlight, but then what are our priorities? What are we going to work on collectively? So all through 24, we met with that significant group to determine, looking at over 100 different measures, whittling them down to 45, then whittling them down even more to figure out what are we going to work on. And the 3 priorities are mental health. We have a significant challenge, and I'm going to share some data on that. Housing, which we get some funny looks sometimes from our hospital partners, like, what are we supposed to do with housing? But it really is a determinant of health. And then the final one is heart disease, because it is the #1 killer. And as you ask for data, it's the #1 killer for, and we don't do it just for Hamilton County, it's for an 18 county region. In our community health needs assessment document, you'll see Hamilton County compared to all other 17 counties. So you can really see how you compare across all the region. But collectively, heart disease is the #1 killer. And we've got a lot of work to do on heart disease. The second one, to your point and your strategy and priority, is cancer. So some quick stats. So the leading cause of death for our region per 100,000 people for heart disease is 207. So 207 deaths per 100,000, and cancer is just behind it at 196.
Wow.
So those are the 2 big things. I also will share with you in the city of Cincinnati, and we're doing some work on behalf of Dr. Mussman, who is the health commissioner for the city of Cincinnati. Yeah. He's very committed to addressing premature death or years of life lost. When people die prematurely, it's a very big challenge. And so there are 5 key drivers of why people are leaving this world earlier than we need them to be. And so when you think about when you compare neighborhood to neighborhood, there's a 25-year gap from our neighborhood to neighborhood in terms of years of life lost. Wow. And there's 5 key reasons for that. One is infant mortality. And you can imagine if a child dies, that's a huge, significant life lost. Then the second one is opioid. And for the infant mortality, we have Cradle Cincinnati. For opioid, we have which is the second one, is the Hamilton County Addiction Response, which you help lead. The third is murder, which we have tons of work on violence to reduce gun violence. The fourth is heart disease, and there's no community collaborative. And the fifth is cancer. So those 2 things, thinking about cancer and heart disease, to really go after the #1 and 2 leading cause of death, and also the very clear part of our disparity we have in our neighborhoods, which is not acceptable. It's shameful. This 25-year gap does not exist. Cleveland is 14 years. Columbus is 11. That's not okay. So those are some of the high-level data that we have from our community health needs assessment. It's over 90 pages. I have lots of data. I can share anything more that you want me to go further on.
Yeah, no, I like the breaking that down, because people would think, the other places would be higher than we are here in the greater Cincinnati area and in this region. So that is shocking as well.
It is really a call to action. It's a shameful fact, and it's been a consistent fact for a number of years. It's not like this just occurred post-COVID. But there is hope, Commissioner Reece. Mm-hmm. You think about the work that we did for infant mortality. We're now leading the state in infant mortality, particularly for Black moms. As you know, many years ago, over 12 years ago, we were the worst in the nation for a county our size. We have completely flipped that. It took political leadership from commissioners and committed community members and committed clinicians to stop and listen to the community and understand what processes we could put in place to get this kind of result, but it took 10 years. Yeah. And so we're really hoping that cancer and heart disease can have that same collective action and that same fantastic outcome, but it's going to take a long time. So one of the things I wanted to share, and you tell me when I can do this, is really provide the opportunity to have some cancer screenings that people can go out in the next few weeks to take care of their own care. And so you let me know how to help share that either online right now or in another way. But I think it's really important to know that the community is there with free screenings in the next few weeks if people are engaged and inspired by your story.
Oh, absolutely. So we are talking with the Health Collaborative, those who might be just tuning in with us. I want to thank Kate Schroeder is checking in from Interact for Health. She's online. Thank you, Kate, for checking in. But one of the things I think was very important to show, like you said, we have to have the data where we are, where we need to go. And then understanding that this is on the long haul. This is not a short sprint. A lot of things that you talk about, I was, president of the Ohio Legislative Black Caucus, where we were fighting for more funding to fight against infant mortality. That was like a big, big deal. And we bring legislators to Children's and to Avondale. And I remember at that time it was our Speaker of the House, and we were like, welcome to Ground Zero. Yep. And that was huge. And then we're into maternal health as well. And so it's a long haul. It's not, it's a lifestyle change. It's not a sprint. It's not, just a branding campaign. And so that's why it's so important to have a Health Collaborative and other organizations that'll be here for the long haul. You're right. The next thing I want to get into is what can people do? The action step. Which is what we always do on Alicia Reece Soulful. What can people do? We got a lot of folks that listen to us that are also pastors and heads of the churches, and they're in organizations. And so we want to make sure that they help us get this information out.
One of the first things is to really check in with your doctor. So if you don't have a doctor, that's a challenge. And the city of Cincinnati has a number of federal qualified health clinics that allow access for lower uninsured. So your doctor is your first bet, but many don't have access to direct primary care. So I want to give some shout outs. July 19th from 7 to 12 at Central Park, which is on Kemper Road, there's a men's health day, which is significant. And so there's going to be offer for health screenings at that event. There's also a number of prostate screenings that's through UC. Again, August 16th, the Black Family Reunion, the 17th, the 18th, the Black Walnut Film in Clifton, and September 20th at the Black Film in Kentucky. So there's a number of prostate screenings as well as the other screening that I talked about in terms of Central Park on the 19th. There is something that's coming up on July 19th, so lots of stuff on July 19th that I think is really important. It requires no payment, no insurance, and no ID. It's dental, medical, and vision through, it's at St. X High School. It's a partnership with St. X High School and RAM, which I think is affiliated with UC medical students. So it's a free Cincy clinic pop-up. So in just the next few weeks, there's lots of places to go. We will put this accessible on our website for folks to know. And we'll partner with folks like Closing the Health Gap to make sure that people get access to these screenings and they can take care of their own care, because that's one of the most important things.
Yeah. So
there's lots out there. We just need support to help get the word out.
Yeah. And that's one of the things that I wanted to have you on the show to help get this word out. When you give us this information, we'll put it out. July 19th, of course, you had a lot of different components, but I will focus on this one.
Yeah.
The one where you say you need no ID, you need no insurance card. We're talking dental, vision,
and
medical screenings at St. X High School. At St. X High School, we'll keep that information out to get as many people, like you said, who don't have doctors, and particularly now with what's all going on. You talked about Washington making those cuts. It's so much in this bill, and people getting cut from the Medicare, the Medicaid. It's just so much. But we want to make sure that people are able to get screened and take care of their health. We also, as you all know, that's one of the major purposes for the 513 relief bus, why I wanted to create that. And we have a number of free screenings and so forth. So we'll put all that on Alicia Reece Soul Food. We'll put a link to the Health Collaborative. You'll be able to go there. You can look at the data. You can find out about the community events. And last but not least, because I know our time is running out, let's talk about these jobs. You mentioned them at the beginning briefly, but we gotta get. I mean, we need people to help take care of people. We want the best, and I know that the county, we put funding to Cincinnati State to help with nurses. But tell us a little bit more about if somebody's listening that's interested in going into the healthcare field.
So again, I had three objectives. Really was for folks to know about the power of the hospitals coming together and invest in this. For someone to think, I can have a job in healthcare. 11,000 jobs open right now. Again, 11,000 of the, I'll say it again, of the top 10 open jobs, 7 of them are 60,000 and above. And many of those only require 2-year degrees. They're nurses, medical assistants, rad techs, surgical techs, all these wonderful jobs. I want to give a shout out to our website that has all of this information. You can seek any job. You can also understand what is it like to be a surgical tech? What do I wear? Who do I work with? What kind of degree do I have to have? In a very simple framework. So if you're interested at all in any job or career exploration, workforce.healthcollab.org/job/seekers. It is.
You just gave us a lot for
Yes.
radio.
Yes, I
Do
did.
you have a main website, and then they can
Yes.
navigate when they get there?
Yes. It's the Health Collaborative's website, and you just simply go to Workforce, our workforce component. So if you Google the Health Collaborative and then click on Workforce, there's a button for job seekers, and all of this will be there. Every single one of these jobs is listed there. You can apply and access them. You can also understand what it's like to be one of them. You can also understand kind of what kind of education is required. We are really committed to it, making sure that we have a healthy workforce so that they can be there for us in our time of need.
Well, I want to thank you for being on here, Alicia Reece Soul Food. We'll definitely have you back. But lots of great, important information that helps people in their own daily lives. You know, like you said, hospitals coming together. Now we've got the data. What are the things we need to attack? And we've got jobs. And we've got free screenings that will help you. The screenings are very, very important. And if we could have these screenings where you don't have the copays, that's one of the things about the 513 relief bus. There's no copay. So, and that can take you out. I believe me, when I go to the doctor, they say, oh, come back in 2 weeks. It's another copay. Okay, I need to see you one more week. There's another copay. One time I said, wait a minute. You've got me here for 2 months straight. And let me look at these copays. It's always a copay. So not having those barriers, reducing those barriers. Thank you for what you're doing, you and your staff with the Health Collaborative. And we'll get this information up on our sites as well. And so we appreciate you coming. If people want to get in touch, you want them to go to the website?
Yeah, the website, or I can give you my email real quickly. It's dbeluan, DBELUAN @healthcollab.org. I'd be happy to talk about any of this. And I really appreciate the opportunity, Commissioner Reece. The Community Health Needs Assessment is one of the most important documents for our region. Not only are we going to look at the data and figure out the 3 priorities, we're going to take action against them so that all the hospitals are thinking about how do they better address and coordinate mental health, how do they better address housing, and how do they better address heart disease. So lots more action coming, not just data.
All righty. Well, I appreciate that. Thank you so much for joining us. Reece Soul Food, your health is your wealth segment. Thank you, Interact for Health, for your partnership on this. And we're going to continue to give information out. And talking 11,000 jobs. Come on now. 11,000 jobs. We're talking free screenings. Come on, no ID, no insurance. at St. X High School, July 19th. The 513 relief bus, completely free. And that's what you call some real hot sauce. We're going to take a quick break. We'll be right back with everything you need to know to get ready for the Cincinnati Black Music Walk of Fame. When we come back after this.
It's the Cincinnati Black Music Walk of Fame free induction ceremony and celebration. Saturday, July 26th at noon, honoring our 2025 inductees, jazz icon Nancy Wilson, the Ohio Players, gospel music legend Dottie Peoples, and the Mighty OJs, with celebrity hosts John Murray and DJ Don Juan, plus live performances by Regina Bell, Second Wind, and Mr. Southern Soul, Big Rock. We're your all right. Bring your fans for our National Line Dance Fest. Help us get to 250,000 visitors this year.
God bless you. I'm Dottie Peoples, and join me on Saturday, July 26th for the 2025 Cincinnati Black Music Walk of Fame induction ceremony. I'm looking for you to be there. See you on July 26th.
All righty. All right, everybody, we're back. Alicia Reece Soul Food. Okay, here we go. Kai Sanat. Now, he is, I think that's how you say his name. He is on the cover of Time magazine. He's a young man that streams. That's when you go live with everything. You can't have all the editing and, all the smoothness, the packaging and all that. I mean, they just go live like I'm live. I'm live on the radio, but I'm live on social media platforms, and that's when you get all the corks, because there's no editing, there's no going in the booth and polishing it up before people hear it. It's just raw. It's live, right? It's live and unedited. So I said, wait a minute, he's on the cover of Time and he's streaming. Maybe I need to get to streaming. But no, congratulations to him. And he's bringing a whole new generation in a way. They're capturing folks. Now, I don't know if I could do all 24 hours and all that stuff of nonstop streaming, because that's a bit much for me. But we are streaming the Alicia Reece Soul Food Show with a new format. And so, yeah, we're super excited. We're on 2 radio stations at the same time, 103.1 FM, 1050 AM, and we're on our social media platforms, Alicia Reece Soul Food, YouTube page, Facebook. Boy, you name it, we're on it right now for this hour of power, if you will. Now, everybody get ready. Get ready for the Cincinnati Black Music Walk of Fame. I want to thank everybody that came out for the documentary. It's not over. That was a sneak peek premiere. And we will have it available for you. And I'll be able to tell you where you can get it. Everyone, I encourage you to see this documentary. I've got so many people that came out and said, oh, I didn't know that. Pastor KZ Smith said, hey, I've been knowing you forever, but I didn't know all this was involved. I knew a lot was involved, but now I didn't know all this. People stopping me. I didn't know. Lavinia Campbell, man, I didn't know this. I didn't know that. A lot was involved. So want to make sure that you all see this documentary. You got to see it. I mean, you just have to see it. Finally sat down. 5 years of my life was dedicated to the Cincinnati Black Music Walk of Fame. 5 years. In addition, I still had my job as a county commissioner. Now, what is the job of the county commissioner? You all voted for me. I appreciate it. 218,338 people voted for me so I could be a county commissioner. Second highest votes in the history, 200 plus history for a county commissioner in Hamilton County. With that being said, my job is to go down there on Tuesday and Thursday and vote up or down on some different issues. The Black Music Walk of Fame, Cincinnati Black Music Walk of Fame, required more if it was going to get done in a quick amount of time. Once we started construction, it took us about 2 years or a little bit less. But the concept and laying the groundwork and had to convince people and had to get the deeds and the how you go finance it and public-private partnership and all of this stuff, from rocks to a Cincinnati Black Music Walk of Fame award winning, it took 5 years out of my life. The sleepless nights, and I still be up all night on it to keep it so it can survive. We've had over 200,000 visitors. We're trying to get to 250,000. That's 250 or more by July 26th. So I want to thank everybody who has gone down there, and I encourage you to come back and bring more people with you. So it took a lot. So I don't want us to start off with the white outfit and the free event. And when you see what it took, you have a greater appreciation of what God does, because I couldn't have done it. I couldn't have done it. Not with all of the traps, not with all of the starting off behind because, you can't do it. A Black woman can't do it. A Black person can't do it. I mean, look at Hollywood. Look at all these other ones. This is big for a Black woman to be able to create and develop something like this. And for me, I know it was all God. So when you see the documentary, you'll see God's work. All the you can't do it, it can't be done, the jealousy, the envy, you got everything. I mean, for God's sakes, we are across the street from the NFL football stadium. We're down the street from the Major League Baseball stadium. And there was something that came out, was talking about June, I believe, 30th in the 1800s, I believe it was, how people that looked like me, the slaves that made it across the river, that's where they was at. Whereas now called the Cincinnati Black Music Walk of Fame, what's now called the Smale Riverfront, what's now houses the NFL stadium and the Major League Baseball stadium, which now houses the Andrew Brady Music Center. All these things are housed, the restaurants, the bars, all that. People that looked like me lived there and was ran out. They had state laws that ran us out of there, pushed us out, ran us out, got us off the land. So don't tell me what God can't do. I don't want to hear it. Now, it's been a lot of work. I mean, even I had surgery. I had all kind of stuff happen. Knee surgery and all kind of things. In some regard, ran my health down in the ground because I've been trying to get this done for the people. So with all of that, we got to be thankful for what God has done. There'll be naysayers, but we can't listen to them because for 235 years now, Hamilton County's been in existence, and you wasn't included. You wasn't included. So we're trying to change, as you heard my last guest talk about systems. The hardest thing in the world is to change a system. So on July 26th, this is not a promotion. I want to repeat, this is not a dance promotion. This is not something that the Black Music Walk of Fame does not pack up and leave. We don't come in for a weekend and then we got to leave and then say, let's get back down here in a year. We are like the zoo. We are like Kings Island. We're like Cedar Point, probably more than them because we're year round. We're free. We're here to stay. And so just like the zoo has their Zufari Gala every year, but they still get open every day, mostly. We have our event, but we still open every single day. The hardest thing I would say is when God gives you a vision and don't give it to everybody, because it gets very difficult to explain it. It gets very difficult to stay focused because nobody, and it becomes very lonely because nobody gets what you're talking about. They don't understand the empowerment fight. They don't understand that it's bigger. Every little thing, it's bigger than the levels that we've been allowed to go in because God didn't take everybody in there. So it gets really rough. So on July the 26th, which is a Saturday, we will be hosting our 5th Cincinnati Black Music Walk of Fame induction ceremony, even though we've only been open. The project wasn't completed, except for this will be our 2nd year of the Black Music Walk of Fame being built. But remember, we were inducting people before it was built. So this is our 5th induction class. Now, the Cincinnati Black Music Walk of Fame has almost 80 plus people down there in it. And people that's down there, you need to be taking people down there because normally they charge you to have your name in stone. They charge you to have your name on something. They call naming rights. Even schools and everything, they have what you call a brick program. You got to pay to have your name. Nobody down there paid to have their name. Nobody down there paid to have their video up. Because I had to go out and get the private money to do it. So when people tell me, I need to be in there, so-and-so need to be in there, I want you to remember that in the 1800s, they ran us off the property. I want you to remember that it was sitting with rocks for over a decade, and you just rolled by there. You just saw nothing but rocks. I want you to remember that the county has been in existence 235 years, and I don't remember anything with your name on it or anybody that looked like us with their names on anything. And then I also want you to go down there and look and see people's names who had to put up money so that their names can be on walls. And then I want you to remember this is all God because it wouldn't be possible. So please, I want to thank everybody that's been down there. Everybody's been bringing their children down there. It's been diverse people going down there. I appreciate it. On Saturday, July 26th, we're taking in our 2025 induction class. The people that we're taking in this year is the late, great Nancy Wilson. Nancy Wilson was one of the most iconic jazz singers of her era. She was one of the first major artists in what we now call Cincy Music Festival. Cincinnati Music Festival. It was called Jazz Festival. And Nancy Wilson was one of the first to play in it. She graduated from Central State University, so I should see a lot of the CSU Marauders down there. Not only did she graduate from there, but she gave money back to Central State. She also gave a lot to the civil rights movement. That's why she's in the Civil Rights Museum. Gave a lot of money to civil rights. She just didn't, some of the artists, they just dancing and collecting and charging tickets and they never gave nothing back. She gave back. She's also one of the first Black women that was on a major television show. So now we own shows now, but she wasn't on there clowning. She was on there as one of the most beautiful, iconic women, and she's been on shows. And then she ended up on Hawaii 5-0 and all those things. She is also the original singer of If I Could. So Regina Bell is coming to salute her and will be performing at the Cincinnati Black Music Walk of Fame, connected to her mentor, the late Nancy Wilson. Number 2, we're taking in the Ohio Players. Now, there's a lot of folks that was in the Ohio Players. Because why? The Ohio Players had an iconic sound that for many years they were told no. Because again, when God gives you something new that nobody else has, you like, that ain't what we looking for. No, that ain't it. We can't do nothing with you. So they had people came and people left and people came and they stayed with their sound. They played the instruments in a different way. It was unorthodox. Now they call that funk. Okay, when you do it unorthodox, it has a name now. They created a new sound. And when they came out with Skin Tight, they hit. Boom. So the Ohio Players, I know most of them are passed on, the original members, but they need to, we can't have the Black Music Walk of Fame, got to have the Ohio Players. Okay? The Ohio Players will be going in. Next, we have the one and only gospel icon, Miss Dottie Peoples. Dottie Peoples is an on-time God, and that's still today. I'm telling you. I'm up here saying sometimes, God, where you at? I need you, I need you. And then he come bigger, greater than I could ever expect. And he right on time. Because I was trying to go too fast. Or maybe I was going too slow. Or maybe I was going down the wrong way. But God comes on in. Every time they think they got me on the Black Music Walk, we got her. We ain't going to promote it. We ain't going to help her. She ain't going to get it done. She can't get the votes. She can't get the private money. Look at my documentary called From the Rocks, y'all. And you'll know that he's an on-time God. So the iconic, beautiful gospel legend, Dottie Peoples herself will be here. And Dottie Peoples says she gonna give y'all a song. So you can't miss it. Huge. Dottie Peoples from Dayton, Ohio. People say, oh, is she from Atlanta? She's from Dayton, Ohio. You'll find out some things about Dottie Peoples. She didn't start off in gospel music, but she's also one of the first to have a tour bus gospel music. She had her own tour bus. She was one of the first that's changed the fashions, I'm told. She wore gowns. So then everybody started wearing gowns. So you'll learn about Dottie Peoples, who will be going into the Cincinnati Black Music Walk of Fame. And then last but certainly not least, this group started as a group called the Mascots. They recorded here in Cincinnati and got one of the big hits that broke them out under the Mascots. But when they went to Cleveland, the DJ said, man, you got a bad song. We love it, but you got to get a new name. You can't be the Mascots. And the DJ's name was OJ, so they became the OJs. The mighty OJs, Rock and Roll Hall of Famers, the OJs. And did you know that they had a person from Cincinnati that was in their group? Nathaniel Best was one of the 3 OJs at one point. So they will be here. They told me Eddie's on his way with the tour bus, and Walter's on his way, and Eric's on his way, and Nathaniel Best is on his way. The mighty OJs will be here. They will be here from what I'm told. Now, during this fabulous event, it's red carpet. We're wearing white. We're wearing white, everybody. That's what we're wearing. Don't come in no other color. We're wearing white. Okay, we got to have our uniform. We're wearing white. Now, if you wear white, they know you're coming for the Cincinnati Black Music Walk of Fame. So we're wearing white. In the documentary, you'll find out why we're wearing white. But we're wearing white. We are having general admission. It's free to get in, and the general admission seats are on a first come, first served basis. First come, first served basis. But we will also have simulcast outside the video, because we have people stay there and watch it. This is an indoor and an outdoor event. And yes, you'll be dancing, so put on some comfortable dance shoes. We're marching in. Everybody lining up. We're going to start marching in at 11:15 inside the building. Now, once we hit capacity, then we got to have the people outside. The Black Music Walk of Fame is outside. It's an outdoor facility. But the induction happens inside. The stars are outside. Okay? Then we come in, we're going to have a induction ceremony that's second to none. We've got John Murray from the Sherry Shepherd Show, executive producer, Emmy Award winning. He will be our host again. When we march in from the outside, it'll be Lincoln Ware, Don Juan for show, and myself. So you ain't going to be out there by yourself. I'm marching in with you. Our parade of stars, led in by the Q Kids. We have Second Wind will be kicking things off with music and dancing. And then we get into the induction ceremony. Don Juan for show is our celebrity DJ. Regina Bell will be doing a special performance for Nancy Wilson. Dottie Peoples will be doing a special performance. And then we go outside for our celebration and national line dance with a live performance by Mr. Southern Soul, Big Rob. That's outside on the big stage. We still in white, ladies and gentlemen. We're still wearing white. And Don Juan for sure will be on the stage with Big Rob, and he will be our celebrity DJ. So all your line dance and everything, bring them fans, get ready, step, bring it all. It's going to be a live, incredible celebration. So that's what's happening on July 26th. If you like to ride Metro, we want to thank Metro, and we want to thank Corinthian Baptist Church and Miss Viola. We will be having a bus, 2 buses. When they're full, they're full. You must register. And we have 2 buses, and you must register. And I'm trying to find the phone number now. It's on here somewhere. But you have to register for the bus. You got to register for the bus. I'm trying to find my number. Every time you're looking for something, you can't find it. Is that? All right. The number to call to get on the bus, 513-281-1280. Maybe we can put that in the chat on the Facebook. People can get it. 513-281-1280. I'm going to say it one more time. 513-281-1280. Ask for Miss Viola Brown to register if you want to ride the bus. You will pull up at Corinthian, then you will get on a bus. But you have to register. And those are really for my seniors. Because I love my seniors. You know I love my senior citizens. So 513-281-1280. And I want to thank compliments of Metro. And they will be taken down in style to the Cincinnati Black Music Walk of Fame. The other things people have asked me, can you bring chairs? No, you cannot. Why not? Is because the Andrew Brady Music Center icon has AstroTurf. They don't have grass. So they don't allow chairs on AstroTurf. That's why chairs are not allowed. Bags, we want to keep small bags. We want small bags. So put that on your calendar as well. Small, but don't come in no big book. Small bags. So that's everything I think you need. Indoor, outdoor, comfortable shoes. We're wearing all white. Yes, you can put the cats on, cowboy hats. You can put the cowboy boots on. Let's go. Bring the fans. Where the fans at? It's July 26th. That's a Saturday. And we're opening the doors at 11:15. And we're rocking out with an induction ceremony that starts at noon, followed by an outdoor line dance celebration that will feature live performance by Big Rob. We also have Regina Bell. We got Dottie Peoples. It's free. I'm going to have some free parking for those who get there early. Now, once it's gone, it's gone. Now, come on now. I can only do so much. And I'm giving you a free thing with a free Black Music Walk of Fame, with a red carpet type of event, with outstanding inductees, with outstanding entertainment. Now, come on. What more do we want? God has done enough. Let's get down there. And sometimes we got to get up and do something for ourselves. Help us get to 250,000 plus visitors for the Cincinnati Black Music Walk of Fame. And I'm getting calls from everybody. So a lot of surprises. You don't know who you'll see at the Cincinnati Black Music Walk of Fame. All right, everybody, that's it. That's enough hot sauce for today. Thank y'all for tuning in. And don't forget the hot sauce. I don't hear my music, but it's on. I hear you. Okay, it's on. It's on. It's on. All right, y'all. I'll see y'all soon. Have a great day.